صرنا كبير إن شاء الله يدرنا دكتور.
أنا لو بقيت قبير أستاذة بأن نعلم للمجتمع في الدراسة.
أنا أبقى كبير ده أبقى دكتورة أتعلم دكتور.
وأكبر أنا أبقى مهندس.
Hello, my name is Mashaka Lewela. I'm the Regional Learning and Knowledge Manager for East and Southern Africa region, Save the Children. Come with me. In 2022, we reached over 15 million children in East and Southern Africa region. And although 2022 was yet another challenging year for the communities and children we work with, we have seen a tremendous impact of our work that we do in our communities. Our Impact Footprint 2022 report brings together evidence of our work, advocacy and policy wins, success stories, and voices of children to showcase the tremendous work our teams are doing across the region. Let's hear more of our achievements in 2022.
Almost all the countries in East and Southern Africa are experiencing the realities of climate change, conflict, and the post-COVID cost of living crisis. Food prices have increased across the region due to a combination of macroeconomic challenges, food harvest issues, and the increase in fuel prices. This leads to a complex situation for many households where we see a restriction in people's access to food, water, health, nutrition, and education services. It's critical at this time that we respond to this crisis and that we continue to be a partner of choice for all stakeholders to ensure that we are at the front line delivering services for children.
In 2022, Save the Children reached 24 million people across East and Southern Africa, of which 65% were children. We believe all children have a right to access quality education. In Somalia, where primary enrolment rates are low, we've been implementing our LEAP Learning Labs. This is an educational method that combines technology and hands-on games in a learner-led learning approach to improve literacy and learning outcomes. After just 12 months, children in our LEAP Learning Labs were 5 times more likely to complete a grade 2 maths problem compared to children who weren't part of the programme. We believe every child deserves a healthy start in life. Towards this, we've implemented our learner treatment kits in Malawi, a country where malaria is the 3rd highest cause of death, especially among children. We're implementing a cost-effective approach to save lives, where children get tested for malaria in school by their teachers, and those who test positive are given a first dose of medication. This helps to ensure children get diagnosed and treated quicker, and therefore reduces further health complications and reduces the amount of time they need to be absent from school. After a successful pilot, the Learner Treatment Kits approach has now been incorporated into the Ministry of Education's National School Health and Nutrition Strategic Plan and the National Malaria Strategic Plan for Malawi to really take our impact to scale. Safety nets and resilient families is a core part of our work. In South Sudan, we're using cash transfers for better nutrition outcomes for children. Cash transfers to families are complemented by group and individual awareness sessions facilitated by our community nutrition volunteers, learning about infant and young child feeding practices and health and water and sanitation practices. As a result, we saw the proportion of children with an acceptable diet increase from 6% to 22%, and the proportion of households with poor food consumption decreased from 39% to just 3%.
In 2022, we saw significant progress in our advocacy and policy influencing work that resulted in changes in laws and policies that promote the rights of children. In Zimbabwe, we saw the passage of the Marriage Act, which outlawed early and forced child marriage in a country that ranked 20th in Africa for having the highest rates of child marriage. The enactment followed nearly a decade of advocacy by several children and our partners in the country, and included consultations with children who are also able to share their views on the impacts of early and forced child marriage, but also they were able to make recommendations with various people. In Zambia, the President assented the Children's Code Act, which for the first time brought together different pieces of legislation that impacted on children. Save the Children was able to join forces with different child rights forums, civil society organizations, and also provided platforms for children to raise their voices on what this would mean for them, where for all stakeholders, everything they needed to know about children and to enforce their rights was to be found in one piece of legislation as opposed to different pieces of legislation in the country. In Ethiopia, we saw an increase in the health budget for Afar and Somali regions, promoting universal health coverage for children. This followed extensive budget analysis and recommendations that were shared with the government. Our Impact Footprint Report 2022 also highlights the voices of children as they share their views on how we can serve them better. Fatuma in Ethiopia shares her reasons for loving school more. Aman in South Sudan shares how restoring his sight has helped him engage in education even better. And we see children from Malawi and Zambia in the inaugural African Children's Parliament sharing with their heads of state and advocating for the school calendar to be changed in response to climate change.
I'm extremely proud of all the Save the Children teams in East and Southern Africa for ensuring that our region continues to be high performing and continually strive to reach the highest standards, improve how we work, and ensure the quality of what we do to ensure that we do the very best we can for children. We can only have done this with the support of all our partners, donors, local and national actors, governments, and of course children. Thank you for delivering with and for children in East and Southern Africa. In 2023, we will build on these successes and continue to focus on delivering the global strategy for children in this region.